and eradicate FMD requires the following interventions. The ideal. Number one, undertaking a biannual compulsory vaccination exercise of the entire susceptible animal herd in the country. And the susceptible herd includes all two-hoofed animals. That's cattle, sheep, goats, and pigs. For purposes of universal coverage, compliance, and biosafety considerations. Since vaccines are live organisms, governments normally offer the vaccines as a public good for control of the live organisms. This, however, varies from country to country, depending on the number of animals and the budget implications for buying the vaccines recurrently, because it's recurrent. The other ideal approach to control and eradication is the test and slaughter, followed by safe disposal of the carcasses by either burning or burying or both. When the veterinary authorities confirm the outbreak, they determine the affected animals and those at risk for destruction. This, however, is followed with compensation by government, which is a very expensive practice. This is the practice in developed livestock countries like the United Kingdom, among others. So you kill, you destroy, but you compensate the farmer. In addition to the above, there is the movement control restrictions, what is famously called quarantine, are always imposed, either in part or as a whole, in the affected geographical location, depending on the epidemiological assessment by the competent authorities. And the competent authorities, Right Honorable Speaker, are veterinary authorities. These animal movement restrictions, however, are temporary measures to disrupt transmission, but their duration depends on the discipline and compliance of the different stakeholders. These are the farmers, the traders, the processors, and the enforcement agencies, and also on the country's ability to implement intervention 1 and 2 above. One is the biannual compulsory vaccination, and 2 is the test and slaughter, but with compensation. Current situation in the country. Right Honorable Speaker and colleagues, there are 36 districts currently affected and under quarantine. These are Budaka, Bukedia, Bukomansimbi, Bunyangabu, Butaleja, Fort Porto City, Gomba, Ibanda, Isinjiro, Kabarole, Kasanda, Kayunga, Kazo, Chibuga, Chibuku, Kiruhura, Kumi, Chankwanzi, Chegegwa, Chotera, Luka, Luengo, Yantonde, Mbarara City, Mitiana, Mpiji, Mubende, Nakaseke, Nakasongora, Namisindwa, Ngora, Ntunga, Moraka, Irwampara, and Zimbabwe. All districts neighboring the aforementioned districts are at high risk and under strict surveillance, and authorities are advised to remain vigilant. These include Apache, Amolata, Bujiri, Bushenyi, Butaleja, Hoima, Iganga, Jinja, Kabare, Kabiramaido, Kairo, Kamuri, Kamwenge, Katakwi, Kasese, Chivare, Chibuga, Chenjo, Jombale, Masindi, Mayoge, Mukono, Namalemba, Nakapiripirit. I'm trying to remember Namalemba, my apologies. Balisa, Rukunjiri, Sirongo, Wakisan Soroti. Policy and control measures in place. Right Honorable Speaker and colleagues, our policy as government on FMD is for government to avail vaccines to farmers as a public good for reasons explained earlier. For so many years, I think since colonial times, government of Uganda through the Ministry of Agriculture, Animal Industry and Fisheries has been providing a budget item for procuring vaccines. This, however, has been insufficient and only covers 1.1% of the susceptible domestic animal population, contrary to the recommended of at least 80% coverage, leaving the rest of the herd vulnerable. This explains why the country experiences repeated outbreaks. Although the Animal Disease Act, Cap 38, empowers the Commissioner of Animal Health to order for the destruction of affected animals under the test and slaughter approach, the country cannot afford to implement this provision of the law due to high compensation budget requirements. Right Honorable Speaker and colleagues, with the budget limitations alluded to above, our ministry adopted the ring vaccination methodology, targeting the locations with animals at high risk. When we buy the few vaccines annually, the budget we get, on average, gives us 500,000 doses. We distribute them to district veterinary officers of most prone districts and those with outbreaks to carry out ring vaccination around the infected herds or kraals. We also institute quarantine and other measures in the affected and susceptible districts to prevent spread or disrupt transmission. Honorable Speaker, our total susceptible animal herd that requires FMD vaccination as per current estimates is 44 million cattle, sheep, goats, and pigs. This therefore requires an annual vaccine stock of 18 million doses for the biannual vaccination requirement at a cost of $2 per dose. The financial implication for this translates into US dollars 176 million. Honorable Speaker and colleagues, government has been studying this financial implication and notes the financial stress it would impose on the national budget if the requirement of the biannual mass vaccination is to be achieved. Accordingly, and with the guidance of the President, a cabinet paper is scheduled for discussion on Monday, 5th February, 2024, that's the next cabinet, to consider a number of policy options, including cost sharing by the farmer. Since the cost per dose is seemingly affordable for most livestock farmers, I will revert to this House and to the country on the final position adopted by Cabinet. In the meantime, Right Honorable Speaker and colleagues, my ministry has repurposed some of the budget you give us, some of our development budget, and managed to avail 2.56 million doses to the country through the DVOs of 94 districts last year. The list is attached on this brief. It shows who took what DVO. Under the same arrangement, we have ordered for 2.3 million doses expected in a few months to come. Right Honorable Speaker and colleagues, another challenge associated with the procuring of FMD vaccines is that they cannot be bought off shelf. Since they are biologicals, they are live organisms with a short shelf life. You order and they manufacture for you. This explains the delay in their supply chain. In the circumstances, Right Honorable Speaker, it becomes inevitable for the Commission of Animal Health, who is the commander of the animal disease control chain in the country, to order or impose animal movement restrictions, or what you know as quarantine, in affected districts. Right Honorable Speaker and honorable colleagues, quarantines are unpopular and an inconvenience to people's livelihoods, but yet again inevitable as temporary measures to control further spread to alarming and uncontrollable epidemic levels. We can lose the whole herd if we don't become strict. If the stakeholders can be disciplined and comply with the quarantine protocols, the disease will resolve or be contained in a very short time, as we also wait for the vaccines. In the past, this has been achieved. Right Honorable Speaker and colleagues, we are also working with our neighbors in Tanzania to collaborate in the fight against FMD, since it is a transboundary disease. The collaboration focuses on areas of synchronization of vaccination calendars, as well as coordination between our veterinary authorities in the clearance of animal movement and disease surveillance across the border. In summary, the following measures are being undertaken by the Ministry of Agriculture, Animal Nutrition and Fisheries, and we call upon all the stakeholders to strictly observe them, and we shall eventually win. Vaccination, ring vaccination around the affected areas with the vaccine stock, as I have explained, what is given and what is coming. Animal movement control, there are checkpoints. Closure of livestock markets, colleagues, that's where the spread starts, from the markets. Because you bring a cow, it's not bought, it goes back with the disease. And institution of quarantine measures. Right Honorable Speaker and colleagues, as earlier stated, our goal is to completely eradicate FMD. The policy measures that the Cabinet is yet to discuss and approve next week will ensure that adequate vaccine stocks are available in the country in time for farmers to access. Vaccination will also be compulsory. Proof of vaccination for every eligible animal will be a precondition for animal movement and market access for animal and animal products. And on this, Right Honorable Speaker and colleagues, I will seek your support in enabling us to achieve this goal of eradicating FMD for Uganda. Responses to specific questions raised in the last sitting and by your directive, Right Honorable Speaker. How long the affected districts have been under quarantine and how long it is anticipated to take. Districts have been placed under quarantine restriction at different times as the disease appears, depending on when the outbreak occurred and the area affected and at risk, provided with vaccines to undertake ring vaccination against FMD, monitored by laboratory testing for FMD clearing, then quarantine restrictions lifted. This also depends on the compliance of the district officials and stakeholders. Some break quarantine deliberately, and we have some districts. I have not mentioned them for now, but we will mention them if need arises. When the ministry noticed an escalation of FMD outbreak due to the farmers and traders moving infected animals to nearby open markets and spreading FMD, a decision was made to institute full quarantine restrictions in all the affected districts and extending the restrictions of the districts that already had restrictions. It is this action that has led to 36 districts being under full quarantine restrictions. It is, however, planned that quarantine restrictions stay in place till the country receives FMD vaccine. Distribution and vaccination are done together with laboratory testing, and then quarantine restrictions will be lifted. This will ensure that the animals are protected, FMD will be controlled, and prospects of animals and animal products trade will be realized. However, with continued surveillance, the quarantine can be lifted earlier, depending on how quickly the disease is contained in an area. Safe trade arrangements in areas not affected by disease are also being discussed between veterinary officials and district authorities. Colleagues know how this can be done, arranging what they call a patchery, where you gather the cows for loading to final destination markets and not return markets. Government's position on availing the vaccine to farmers. As explained above, Right Honorable and colleagues, in the next 1 or 2 months, we expect to receive and dispatch 2.3 million doses of the vaccine to these affected and susceptible districts for ring vaccination scale up, because it was started last year. I will again brief Parliament, perhaps in the next 1 month, on the new policy positions Cabinet will have taken on the matter. Related to the Right Honorable Speaker, allow me to also inform you that NARO, the National Agricultural Research Organization, has started on the process of formulating and developing our own FMD vaccine. The scientists have so far formulated 2 monovalent, a combination of 2 stereotypes of FMD virus, FMD candidate vaccines, and are due for evaluation and further scrutiny by the country's regulatory bodies, ND and National Council. When the evaluation of the candidate vaccines comes out successful, NARO will be authorized to carry out trials for determination. If this level is also successful, government will further support NARO to produce for mass rollout, as is happening with the anti-tick vaccine. That's when we are for mass rollout. We don't do COVID vaccine, Right Honorable. Someone is mentioning COVID. This is not for NARO. 3, government to present the short and long-term measures to manage economic effects for the outbreak in the affected districts. In the short term, Right Honorable Speaker and colleagues, government will prioritize availability of vaccines as explained. Also prioritizing these FMD-prone districts for increased development of water for production facilities, because the more animals move in search for water and pasture, the more they spread and the more they become vulnerable. We shall also increase availability of farm mechanization equipment for affordable animal feed production, to encourage intensive farming, and reduce extensive animal roaming that facilitates disease spread. As a long-term measure, vaccine production is being prioritized under NARO. In this regard, I thank you, Right Honorable Speaker, for having visited NARO with colleague MPs and for your pledge to support their research funding gaps. How long the disease spread to various districts, and yet how did the disease spread to other districts, and yet there are measures put in place? Honorable Speaker and colleagues, where the competent authority in MAIF has put in place these disease control measures, there is a lack of cooperation and compliance among stakeholders in some districts, not all, but some districts. Quite often there is a clash and sometimes connivance as enforcement personnel and veterinary officials to flout these measures. They want markets to go on for revenue while facilitating disease transmission. This is how and why the disease further spreads and the quarantine duration inevitably gets prolonged. What support does MAIF need from the stakeholders? Honorable Speaker, the most sustainable solution is the ideal approach explained above of routine biannual compulsory FMD vaccination for all the susceptible animals. In the meantime, as we process the proposed policy measures through Cabinet, we seek the support of a supplementary budget. Right Honorable, we have a meeting with the Minister of Finance at 4, if you allow me to go, to see the possibility of procuring 10 million doses. Again, we've never gotten any to cover all the affected and high-risk districts, and also support and equip district veterinary officials with the disease surveillance tools and resources, more personnel, and enabling infrastructure like cold rooms for vaccines. Because if we get more doses, they require for safe storage. Conclusion, Right Honorable Speaker. As I conclude, I would like to appeal to honorable colleagues and fellow farmers to appreciate and support these measures and bear with government as we fight to control and eradicate FMD. I further appeal to the district veterinary authorities to ensure strict disease surveillance, timely reporting, and ensure transparency and accountability in the demonstration of the government-provided vaccines. I further appeal to fellow political leaders, especially the district local governments, to respect and support the disease control chain of command with veterinary scientists in the lead. Let them lead and we support them. I thank you, Right Honorable Speaker and colleagues, for listening to me.
Thank you. Thank you, Honorable Minister. No, colleagues, at the time of debate, we don't deal with clarification. It's a debate. So, Honorable Minister, I want to thank you. Please. Number one, the vibrancy you brought to the ministry and the passion which you have for the agriculture sector, with the support of your colleagues, Honorable Afande Ramirama, Honorable Adoa, and Honorable Chakuraga. I visited Naro. Honorable colleagues, I would urge each one of you, because you see, sometimes the minister kept calling me, visit Naro, visit Naro. So, but what do I do at Naro? But I feel every month I should visit Naro. They are doing a fantastic job. These are our professionals who do not know about our politics. They know about technical work. The only thing they need is our support. Because when you look at the commercial, if we can commercialize what they are doing, or you can find they are able to even bring down the cost of these vaccines by more than half. But also they steady supply, quick supply, instead of waiting for all this period. So during this budgeting period, Committee on Agriculture and Committee on Budget, please, issues of supporting NARO. These are issues, let's put our foot on. We are an agriculture-based economy. We can't run away from this. And I promise I will follow up because they are doing a fantastic job. Honorable colleagues, you have heard the minister, and you will allow me, I start with members from the cattle code and professionals in the area. Yes, Dr. Bwanika, when he's presenting on these matters, you know, okay? Then members of the budget committee, I beg you listen so that you know what you're going to implement. Okay. So let me start with Honorable Kajwenje. I add on Chiruhura. I add on Gomba. I add on Chankwanzi. Kwizera, I don't have many cows in Iksoro, but I will allow you. I allow Amorata. No, but Honorable colleagues, what I promise you is, if you don't become selfish, you take wrong. Please, I promised you to give you time on this issue. So just take your time. So let's do very quick, and then we come to the doctor. Yeah. No, I'm going to pick you, Honorable colleagues. Yes, please, Honorable Kajwenji.
Right Honorable Speaker, thank you so much. I have listened to the Minister of Agriculture, a very good statement, but I'm at pains. I also acknowledge that the team at MAIF is doing a great job. However, I come here with a heavy laden heart. My constituents, the people of Nyabushozi, who are now under a quarantine restriction, who cannot sell anything, who depend 99% on the cattle, who next week are supposed to take their children to school. They cannot sell their milk, they cannot service their loans, they cannot get treated, they can't even treat the sick animals. Just because somebody, the minister, named the commander of the disease by a stroke of a pen, imposed a quarantine restriction. And why a quarantine restriction? For a disease, a viral disease that can be eradicated. Right Honorable Speaker, this country, under the NRM leadership, has eradicated diseases. Why on earth can't we eradicate FMD? Yet the livestock subsector contributes significantly to our national budget. Is it poor planning? Is it poor budgeting? I want to attribute it to poor planning. I'm sorry for that. Let me say this. The statement clearly says the vaccine costs $2. But treating a sick cow is $20. It's more expensive tenfold. So why can't we have sufficient vaccine vials in the country? Two, let me say this, right Honorable Speaker. Amazingly, our farmers buy more expensive vaccines on their own. They buy injectables on their own, more expensive than FMD vaccine. If, let me state, the Ministry of Agriculture cannot procure sufficient doses to cover the national herd, get out of business. Let the farmers, let the cattle keepers, let the cooperatives purchase these vials. The government and all governments worldwide know what they do best: regulation. Regulate the importation, regulate safekeeping, regulate vaccine exercise. But let these vaccination be sufficient and available on the market. Or allow farmer cooperatives like I have in Nyabushozi. Farmers have grouped themselves in cooperatives. They have the necessary resources. it requires them to have fridges, require them to have all the necessary facilities to keep vaccines, but allow them to procure vaccines on their own. Right Honorable Speaker, ring vaccination is a lazy policy. It's a completely lazy policy. Why? It comes after outbreak. Vaccination, or what you can call inoculation, comes before the disease outbreak. So why do we wait for the disease to come, then we go for vaccination? That is treatment. Let's have a biannual vaccination of 6 months, twice a year, and complete the process. What do we do? Honorable Minister, you mentioned it. Next week, the whole country, Right Honorable Speaker, the schools are opening. What are we going to do with our children? What are people going to eat? What are we going to use to treat our animals?
Yeah, but Honorable,
and the government is here?
Honorable Kajwin,
yes.
Are you saying you want the minister to lift and open
in the first
the quarantine? Because you see, when you're talking of next week, you're talking of immediate and short term.
Absolutely.
Okay.
This quarantine is not helping anything, Right Honorable Speaker. I can tell you, we are only treating, we are not vaccinating. There's already an outbreak. You inoculate or you vaccinate before an outbreak. It is even unheard of that we should be here on the floor of Parliament discussing that the whole country has an outbreak of FMD. It is bad for our economy.
Because
it is bad for business.
Our fear, take it for example, during the time of COVID.
Yes, right.
You vaccinated, but you were also treating.
Yes.
Okay?
Yes.
Because COVID had already come.
Yes.
Would you say that now open the country, COVID is already here with us, or we just put in place some measures?
You asked me
because
right.
Why I'm raising this, Honorable? I'm not, why I'm asking you and the Director, Honorable, my fear is if the minister does what you are talking about now, okay? Won't this spread go escalate and go out of control? And the people we are saying we want help, instead we find we are not helping them at all. I just wanted that to be very clear, that the minister knows what we are asking.
Thank you, Right Honorable Speaker. From the statement read by the minister, 3/4 of the country are under quarantine. So what are you quarantining for? We need to treat them. It's actually now we are looking for treatment. It's not inoculation anymore. That's my point.
Okay, thank you.
Thank you, Right Honorable Speaker.
So, Honorable colleagues, I had. Okay, no need for panicking, Honorable colleagues. Chiruhura, Gomba, I had allowed Moses, yeah, and then I had allowed Chankwanzi. I'm going to give you time. Whenever your turn, I met you buying cows in Mbarara. So I hope they had no FMD. Yes. Switch on. Can you get another microphone? The microphone is, yeah, get.
Thank you, Right Honorable Speaker. And I want to thank the Minister for the statement. Right Honorable Speaker, you can see what we are going through. I appreciate my colleague Honorable Kajwin on what he has raised. Right Honorable Speaker, first of all, we are here, but our people are passing through a very difficult situation. The people we are representing here. Right Honorable Speaker, I am happy that the minister asked for the supplementary budget. I commend this House that we provide that immediately. Supplementary budget to purchase the vaccine. 2, Right Honorable Speaker, we need to do mass vaccination. Ring vaccination at the moment is not helping us at all. We need to do mass vaccination. Right Honorable Speaker, thirdly, I want you to put yourselves in our shoes. Our children are not going to school. The districts are very stuck. We need to go on the ground and show these people that we are concerned as leaders, as a country. Right, Honorable Speaker, we request the Ministry, we want to inform the Ministry of Agriculture. Let's move with them on the ground. Let them go and explain to people. As much as we are putting measures, we have to show concern, Right, Honorable Speaker. But we are passing through a difficult situation and we are not happy because people don't see the solution while we are here as members of Parliament when they are suffering. I beg to submit. Thank you.
Gomba, then Diantondo.
Thank you so much, Right Honorable Speaker. And through you, I would like to thank the Minister for the report. Right Honorable Speaker, I listened in very well, and I've listened to my colleagues, Honorable Kajwenje and Honorable from Chiruhura. Right Honorable Speaker, I don't know if the ministries are aware that on top of the farmers trying to get their own vaccines, the market is also flooded with fake vaccines. When I was listening to the minister, I thought he would bring it up on how they are going to curb the fake vaccines on the market. Right Honorable Speaker, we were here before, and we talked about it for the Ministry of Trade and the Ministry of Agriculture. It is unfortunate that the farmers are buying vaccines and the vaccines, most of them are fake. And the ministry is seated back and we are suffering. Right Honorable Speaker, my second point, I would like to thank the ministry. I don't know why we often firefight. From the Honorable Minister's report, it looks like now we are firefighting, fire brigade, as if we didn't know this. He said they are going to have a meeting, but we've taken more or less 6 months in quarantine.
Conclude.
As I conclude, Right Honorable Speaker, the DVOs don't have enough facilitation. They cannot reach out to our farmers. And in your submission, you say that you're going to meet and do facilitation. Now, facilitation in which particular capacity? Is it for transport? Is it for buying bicycles like I've seen here in the report, or the rest? Can we have enough facilitation, at least for the farmers, to get enough sensitization and also kindly?
Thank you, Diantonde. Then Moses.
Thank you, Mr. Right Honorable Speaker, and the Honorable Minister for the report. First of all, I agree. I want to support the Minister on one side. Honestly, ring vaccination works. And then, of course, mass vaccination would be better. But based on his report, certainly we don't have all the resources to do mass vaccination. So the best option for now is to take the ring vaccination. At least it's working in the Antonde. I must appreciate what the ministry is doing. But then the challenge that comes with the vaccine takes 6 months, implying that every after 6 months, we must revaccinate or we must boost the vaccine that we've used. Right Honorable Speaker, I think the question should be, as much as we are looking at giving a supplementary budget, why don't we channel more money in having the factory or the vaccine manufacturing locally be implemented so that annually we can deal with the problem for good? Because we are going to pass a supplementary today and we will not get the answer tomorrow. That's number one. Number two, Right Honorable Speaker, there's something the Honorable Minister mentioned. The type of vaccine that we are trying to manufacture, it's a 2 serotype. But apparently what we are also using is more of the same. And it's apparent, according to the DVOs, it's not working effectively. They're appreciating the recent one, which has 7 variants or variants, is much better. I think you're getting it from the UK. They're insisting. Also, us investing in a vaccine of 2 serotypes, which may not work for us, we should invest more in having more serotypes so that it can be more effective than we are planning to invest. Lastly, Right Honorable Speaker.
Thank you. Now, Honorable colleagues, Honorable Kajwenje raised a very important point that government should be doing regulation. And really, I'm not imputing any ill motive, or I'm asking myself, are these vaccines even reaching the small people? Someone who has 1,000 cows, how do we buy for them vaccines? Why can't he sell 2 cows and buy vaccine? Because even me, I have my own agriculture practices, gardens I'm looking after. And then the Minister for Agriculture would say, for example, the Minister for Agriculture would say, before you sell a cow through regulation, that cow should have a certificate of vaccination. Okay? And now these people who are having their big farms, thousands, because I usually see them bragging, saying for us who don't have cows, we are not rich. Now you who is rich, why are you waiting for government to give you vaccines? Okay? Why don't we go on regulation instead of spending these 100 billions? Then government will be able to control the type of vaccine, the vaccination process, and one is issued a certificate. And then we can say, for people of less than 50 cows, maybe, no, listen, maybe for 50 and below, you can say we're helping them. But someone who has 3,000 cows and is seated waiting for government to give them vaccines. Really? Oh no, Minister, I saw you were anxious to do.
Right, Honorable. I plead for a minute. I want to thank you, colleagues, for discussing this issue soberly. And I feel for you because our livelihoods are disrupted. The point for you're raising are some of the policy propositions Cabinet will look at. But let me explain to you the science, why the scientists, since time immemorial, insisted that the government must buy the vaccines and give them out. One, take the lead. One, those vaccines, I'm not a veterinary, but I've been coached. And I can remember what they've told me. Yes, they have coached me because I am not a vet. Buanaka will correct me if I get a mistake, Honorable. Is that these are live organisms. Yeah, they are biological substances. And when you are importing, you import for the type of the virus you have. If you allow X, Y, Z to import, just a minute, I'm coming to that. You can even import for the strains you don't have in your own country. So the options we have now for discussion in the cabinet, because it's a policy reversal now, I believe we would have some policy reform. We have established without any doubt that sure a farmer can afford. Even if you're a 3-5 cows. We have established this, and at the ministry level, we have built consensus on that. So the guidance from the president, which will be further discussed, is government import, have national veterinary medical stores for safe storage, and then send to the people, they pay through the national payment system of local government and Ministry of Finance. So that's why I could not conclusively give you this position until cabinet endorses it. We are certainly moving there. Now, the point of why do we panic? It's not that we are not aware of this, but I have told you, perennially, the ministry has been getting 1.1%, 500,000 doses. Here, we are the least funded. Ministry of Health is able to fight the vaccinatable diseases because there are many partners that put money in the basket, which is not the same with the agricultural sector. So colleagues, I feel what you feel. Let us require the money initially, import the vaccines, and ask the farmers to pay for them. I am sure I will pitch for this position in the cabinet, and colleagues will support me.
And the farmers will support you. Moses.
Thank you very much, Right Honourable Speaker. I think one of the positions which I wanted to present is clearly articulated